Make sure. I think I'm recording. Yeah. Okay. So welcome to the exam 3 review. This is a good sort of outline of what you need to know for the test. So I'm going to go over. I guess I would break the topics down for this exam into respiratory, cardiac, blood components, and then a little bit of metabolic. So we're going to start with respiratory. I mean, you need to know the basic process that ventilation is the process of breathing air into the lungs and then exhaling. So you're breathing in oxygen and you're exhaling CO2. And you need to know about red blood cells, about hemoglobin, which are the proteins attached to red blood cells. So they carry both oxygen and carbon dioxide. We think of them primarily as being the oxygen carrying molecules. And you need to remember that erythrocytes is just the medical term for red blood cells. So you could be asked a question about like which type of cell delivers oxygen to tissue, and then the answer is going to be your erythrocytes. So you need to make sure that you recognize both the layman's term and then the medical term for red blood cells and what they do. So in terms of your respiratory system, really your patient's oxygen level should be above 90%. And if it's not, then they probably need oxygen. So you need to be able to recognize sort of what the baseline minimum oxygen saturation is. And then all of these things here are signs of respiratory distress that you need to be able to recognize. So tachypnea is fast breathing, and then Rales, rhonchi, wheezing, these are what we call adventitious breath sounds. So when you hear those noises in the lung fields. So accessory muscle use, this is going to be like retraction. Sometimes you'll see kids pulling in around their clavicles, or their nose is flaring, or you see them kind of belly breathing, like huffing and puffing. All of that is accessory muscle use. So cyanosis of nail beds is one that usually see over time, but it's still considered one of the symptoms of respiratory distress. So this is like looking a little bit blue in the nail bed. This is not something you see like if you're lacking oxygen for 5 minutes, but if someone has had a lack of oxygen for an extended period of time, you'll see this. And this still falls under the category of signs and symptoms of respiratory distress. Sometimes if they're having a hard time breathing, they're not getting adequate oxygen levels, or they're not able to exhale their carbon dioxide, they can be a little bit irritable or confused. And then stridor. Stridor is that high-pitched noise. So we talk about wheezing, particularly in asthma, which is that high-pitched noise on exhalation. So stridor is on inhalation. We hear stridor with croup and also with epiglottitis.
You said that's with inhalation, right? Not breathing out. That's when we're okay.
Yeah, wheezing. So with an asthmatic, you hear that high-pitched noise when they're breathing out, but you'll hear it when they're breathing in. If there's narrowing of the upper part of the airway.
Okay.
And then there's a question here. What's another name for the common cold? It's right below it. It's coryza. That is definitely one of the terms that you need to know. So, if someone just said to you, what is another term for the common cold? You should be able to be like, boom, it's coryza. And, coryza is caused by a virus, and it's different than allergies, primarily because when you have allergies, you don't have a fever at all. So allergies, you still have the sneezing and the itchy, watery eyes, but there's no fever. So you should definitely be able to differentiate between having allergies and having the common cold. And just like, here with erythrocytes, you need to recognize that's the same thing as a red blood cell. You need to recognize that coryza is the same thing as a common cold. So the lungs start developing around 24 weeks gestation. So one of the reasons, premature infants have a harder time than full-term infants is the lungs they're not really fully developed if they're premature, because they don't really even start developing until 24 weeks. So when they're born prematurely, they just don't have the same ability to oxygenate and ventilate as children that are more gestationally old. So there's a specific substance produced by the lungs called surfactant. And that's what prevents the alveoli from collapsing. So they need that in order to have like their lungs stay expanded. So sometimes they give surfactant to premature infants. And then atelectasis is the name of the term for collapse of the alveoli. And I just want to say, I'm tongue-tied. So it's not that the lungs don't develop, they start developing, but they don't start producing surfactant until 24 weeks. But still, their lungs don't have the ability to stay open without that surfactant, which starts at 24 weeks. So you need to be able to recognize, a lot of viruses start as like upper airway congestion, but sometimes they can cause pneumonia. So RSV is the virus that is most likely to cause viral pneumonia in infants. You should be able to pick out which one is most likely to cause viral pneumonia. And then asthma, even though we didn't talk about it a ton in class, you certainly need to be able to recognize that it is one of the most common chronic illnesses in children, and it's a primary reason that they miss school. A lot of kids have asthma, so making sure that you recognize the importance of good education with asthma in terms of like how to use their meter dose inhaler. Usually you want kids to have a spacer so that the medication goes into the spacer and then they can inhale it into their lungs. Helping parents avoid triggers for asthma. All of those things are really important because it is a leading cause of absenteeism in school, and it also causes a lot of kids to get hospitalized. So cystic fibrosis doesn't just affect the lungs, but we put it in with the respiratory system. So you need to remember that this is a genetic condition. So for children to have cystic fibrosis, both of their parents must be carriers. They get the gene from both parents. It causes thick secretions throughout their body. We think of it most often in the lungs. But it does cause other problems. So it does cause nutritional problems. They don't have the same ability to absorb particularly fat because they don't produce the same digestive enzymes from their pancreas. They lose a lot of sodium chloride or salt in their sweat. So they need added salt in their diet because they lose a lot of salt in their sweat. And
Is
they
that why
tend to
they
have,
say they taste salty when you kiss
yeah,
them?
yeah,
Yeah,
yeah.
okay,
And they literally do. Yeah.
okay.
And they tend to have these bulky, foul smelling stools. This has to do with their inability to digest fat in particular. And then it also causes infertility.
Now, would
So
they be on a high fat diet then, since they're not able to break it down? Like, how do you turn that around? Is it just more of vitamins?
yeah, it's more giving them the pancreatic enzymes that they need to break down what they're eating. So they take fat soluble vitamins. So they almost always take what's called ADAC, which is vitamins A, D, E, and K, is like a vitamin that they take with their food. And they also take pancreatic enzymes that they're like capsules that they sprinkle on their food. So you give
Okay.
them the enzymes that they need to
This
be
is
able
the
to
one you
break
have
it.
to make sure you don't let it get around their mouth and they have to wipe it off because it can burn them. It can cause,
It can cause like thrush and stuff. Yeah.
yeah,
So
okay.
yeah. And the enzymes need to be given around the food, right? Because so you can't just like give the enzymes on a schedule when they're not eating because they need them when their food is hitting their GI tract.
Okay.
And then the laryngotracheal bronchitis. This is, another word for croup. So on this test, you do need to be able to remember erythrocytes or red blood cells. Coryza is the common cold. So there's like, several terms that have like the common term and then like the medical term. So laryngeotracheal bronchitis is croup. And croup is most characteristic thing with croup is that they have stridor. So that high pitched noise on inhalation. And they also have a barking cough. Sometimes it's described as like a seal-like cough, like so it can be dangerous. Sometimes they have to get admitted into the hospital, but usually it's managed at home. Sometimes they get steroids. This is the one where they tell the parents to put them somewhere where there's moist air, like a humidifier or something like that, to try to moist air is better than dry air for them. And then epiglottitis is swelling of the tissue right above the vocal cord. So this is the one that you need to recognize. If you ever see epiglottitis, this is a medical emergency. This is where, as the nurse, you're going to prepare for intubation. If they come in, you're working in the emergency room and they say, kid in room 2 maybe has epiglottitis, you're going to get the airway card out there and move towards intubation. So these kids, a lot of times their airway is so tight that they can't talk. You might hear stridor, but sometimes like there's having such a hard time breathing that you're not really hearing any air movement at all. They tend to be leaning forward. We call it tripod posturing and drooling. So these are both terms that I know that you need to know, and you should, recognize the basic symptoms of both. So epiglottitis is like, that's the medical emergency. Whenever you see that, you think about making sure you secure that child's airway, probably going to be intubated. And it's usually caused by H influenza. So that is the quick and dirty on the respiratory. So cardiac, I'm going to say, is pretty heavily tested on this test. So I would definitely go through that PowerPoint that we went over in class about cardiac. There's several cardiac questions on the test. And whenever you're, sometimes you're presented with a test question where you might not know the answer, but there's keys. So tachy always means fast. So tachycardia is a fast heart rate, and tachypnea is a fast respiratory rate. So if you are ever given a test question and you don't know what words mean, there's probably going to be clues. So tachy is fast, brady is slow. So bradycardia is a slow heart rate. What's the word for a slow respiratory rate?
With slow bradypnea?
Yeah, bradypnea. Yeah. And then dys means ill or bad. So dyspnea is like having a hard time breathing. Dysphagia is having a hard time swallowing. And then hypo means small. So there's a specific heart defect that I don't think we really went into in class, but it's one of the more severe ones, and it's hypoplastic left heart syndrome. So just based on the fact that hypo means small, what do you think is wrong when you have hypoplastic left heart syndrome?
It's not fully, I would say it's either not fully developed or it's smaller than what it should be. So it's not flowing correctly.
Yeah, so very good. So when you have a hypoplastic left heart syndrome, you have a small left ventricle, you have a small aorta. The structures on the left side of the heart are too small.
And that's what pushes out to the left side is what pushes out to the body, which is supposed to be more forceful.
Yeah.
Okay.
Yes. So that's why it's a very, very severe. These kids don't go home from the hospital. They have surgery in their first week of life. It's one of the more severe defects. So a shunt is when abnormal blood flow through a heart. So it goes from one chamber to another. So we talk about like an ASD and a VSD. There's a shunt across the upper chambers of the heart or the lower chambers of the heart.
So it's going through where it's not supposed to be, right?
Yeah. And it's going through usually because there's a hole there, right? So like when you have an ASD, there's an opening between the top two chambers of your heart. So then the blood is going through that hole, but it's not supposed to go through. It's not supposed to go from the, one atrium to the other. And it does, but there's also a hole there that's not supposed to be there. So cyanotic is blue, so not having enough oxygen, and acyanotic is near normal or normal saturation, so not being blue. And then stroke volume is the amount of blood pumped out of your heart with each contraction. So for several of the defects, just kind of remembering the basic structure of the heart. So ASD is atrial septal defect. So your atrium are your top chambers of the heart. So here you go. The blood is going to shunt from the left atrium to the right atrium because there's a hole between those two chambers.
And is it because the left side is more forceful and that's why it's pushing it over there?
Yes. So the left side of the heart is the higher pressure. Since it has to pump to the body, it has more pressure, more stroke volume, more strength. And so it always goes down a pressure gradient. So the higher pressure is on the left side. So both an ASD and a VSD, the blood goes from left to right.
Okay.
And we talked about this, but it points it out here. So if you have one of those left to right shunts, ASD, VSD, PDA, do you have increased or decreased blood flow to the lungs if it goes from the left to the right?
I would think it would be increased because it's pushing it harder.
Yeah, it's pushing it to the right side.
Yeah.
And then there's more blood on the right side to go out to the lungs. So go ahead and ask me, Jessica.
I was just, so as it's pushing it, like even with the pulmonary one, the P, what is that? The P, I don't know how you
pronounce patent ductus arteriosus.
Yeah, which is the pulmonary one, right?
Well, I'll pull it up here and then we'll go back to VSD. So this is the patent ductus arteriosus. So you see here, the thing for me, the thing that made patent ductus arteriosus make sense is that when you're in utero before you're born, you don't use your lungs. You're not using your lungs for oxygenation and carbon, for gas exchange. So because of that, you have to have this opening. This is your aorta and this is your pulmonary artery. So you have to have that opening before you're born, because you have to have a way to redirect blood away from your lungs, because you're not using your lungs. All of that gas exchange is happening through your umbilical artery and vein and across the placenta and your mom. So this is like has to be there for fetal life.
But
So
it
when
has
this
to close once they're born.
Yeah. So when this stays open, then they have a patent ductus arteriosus. Everyone's born with a patent ductus arteriosus, but it should close within 3 days of being born. So when it
Now,
stays open,
when it's going and there's more pushing into the lungs, right?
yeah,
Is there a chance of with the blood going in there that's getting into the lungs, isn't it? Like it's
Yeah.
too much. So you can
it is
cool
too much. Yeah.
right?
Yeah, they end up with pulmonary congestion. You see really fluffy white lungs on x-ray. They're getting too much blood flow. But you'll see here, so this big one here is your aorta, and this blue one here is your pulmonary artery. So when this stays open, the blood goes out the left side to the aorta, and then it falls back into the pulmonary artery and it goes to the lungs.
Okay. And it's not oxygenated yet, right?
So it is, because it leaves, it's coming here from the left side, but then instead of going out to the body, some of it goes back to the lungs.
Okay. Sorry.
No, it's better to ask questions. So this one, sometimes they do surgery, sometimes they close it in the cath lab, and then there's a medication called indomethacin that causes it to close.
Would that be like a steroidal?
No, I don't honestly know the category what indomethacin is. So to keep it open, so some cardiac defects, for example, we talked about hypoplastic left heart syndrome, the left ventricle is very, very small. So in that case, they want this open until they have their first surgery, because otherwise there's not enough blood going to the body. So then they give them a medication called prostaglandin that keeps it open. So prostaglandin is a hormone that you produce. And that, as that hormone goes away after you're born, normally this closes. So indomethacin, I'm pretty sure it blocks prostaglandin. It's the opposite. It does the opposite of prostaglandin.
Okay.
So they can try indomethacin. They can do surgery depending, and sometimes they can put a device in here to close that communication. Okay. But the three defects that cause left to right shunt and increased pulmonary blood flow are your ASD, your VSD, and then your patent ductus arteriosus, which is your PDA. And the ASD is that opening between the top chambers, the atrium. Your VSD is the opening between the bottom chambers, which are your ventricles.
Okay.
So coarctation of the aorta, this is a good picture of it here. Your left ventricle, blood goes out your aorta, and then here it narrows. So it's a narrowing of your aorta. This is the one where they tend to have a higher blood pressure in their arms and a lower blood pressure in their legs. So this is one where you see a blood pressure discrepancy.
So it's a higher BP in the upper, lower, and lower in the lower extremities.
Yeah. So you almost always, when you're worried they might have a coarctation, you'll do what they call a 4-point blood pressure. So you'll do both arms and both legs and see what it is.
Okay.
And then there's two on here that are probably the two most complicated. So there's the tetralogy of Fallot, which has four components. The ventricular septal defect, so that opening between the two ventricles. Pulmonary stenosis. So this is narrowing of what we call the right ventricular outflow tract. So having a hard time leaving from the right side of the heart out to the lungs. And overriding aorta. So this is your aorta here. So it's pushed to the right. So some blood from the right side ends up going out the aorta. So you end up getting some deoxygenated blood that goes out your aorta. And right ventricular hypertrophy. So since there's problems with the right ventricular outflow tract, this pulmonary stenosis, the right ventricle pumps harder to push the blood across that area of narrowing, so then it becomes hypertrophy. So this right ventricular hypertrophy is related to the pulmonary stenosis. So this, they have to have surgery.
The kids, you find them in the squatting position.
Yes,
This is what
yes.
helps them to return that blood flow back up, right?
Yes, yes, yes.
Okay.
Yes, so that's like the key thing. Yeah, like something that's commonly on the NCLEX and the HESI is your nursing intervention. They call them hypercyanotic or TET spells, is when you push their knees into their chest, and that decreases or it increases their blood flow back to the right side of the heart, so there's more blood to go to the lungs.
So this pushes it back to the right side.
Mm-hmm. Yeah, increases their venous return back to their heart.
Okay.
So this one, they have to have surgery. Obviously, it's a complicated defect. This is not something they can fix in the cath lab. And then you guessed this, Jess, when we were talking about hypo. So hypoplastic left heart syndrome, you can see here, this is your left ventricle. It's normally a little bit bigger than your right ventricle, and here it's really small. And you get this teeny tiny dwindling aorta. And then this is the one where they'll leave that, they'll put them on prostaglandin, and then they'll keep that patent ductus arteriosus open. They'll keep that duct open until they have surgery, because they need blood from their pulmonary artery to go to their body. Otherwise, they wouldn't have enough blood flow to their body because their aorta is so small.
So is it both? It's both the aorta and the ventricle that are small?
Mm-hmm.
And so for them, like it's saying here, the 3 surgeries, they're widening it, like they're trying to make it big. Like, how do they even?
Yeah, so I will tell you, but I will also tell you, you don't need to know this, but
okay, then
I'll tell you. I'll tell you. I will 100% tell you. So a Norwood procedure is they fuse the pulmonary artery and the aorta. So they make one outflow tract from the heart. So they'll, they also, they need to have a VSE also. So they make them have a single ventricle. So they'll have like one big ventricle that's a combination of both their right ventricle and their left ventricle. And then they fuse these 2 vessels together to make one big outflow tract. So then they'll have to redirect blood flow down. So then they do a shunt. They create a shunt that will take from their single ventricle that they create back to their lungs. So that's their first surgery. And then their second surgery is this, what they call the bidirectional Glenn. So you have 2 superior vena cava, which is the big veins that drain blood from your head in a sense back down to your heart. So they hook those directly up to your pulmonary artery. So those, instead of going to your heart, they go directly into your lungs. And then the Fontan, they take the inferior vena cava and they hook it directly up to your heart. So they end up, yeah.
Wow. I mean, it makes sense. I get it. I do. I understand. I get it. Like when you fix one, you got to do the other. So they're, yeah.
Yeah. So it's honestly, it's a sad diagnosis. These kids don't, a lot of them, it depends on the center, but a lot of them die in infancy, even if they get their surgery. So it's hard. So when we're talking about cardiac, it's important to remember the names of the tests. So like aortography is a test that produces x-rays of the aorta. So you inject an opaque material and then you get the x-ray. You would do this for something like coarctation to try to look better at the aorta. An echocardiogram uses sound waves to get pictures of the heart. You'll do it like if they have a murmur or something like that to see, identify if there's something structurally wrong, identify where the murmur is coming from. You've probably talked about heart failure in the adult world. So things that you definitely worry about with children is tachycardia at rest, poor feeding, sudden weight gain, and dyspnea. things that you would really worry about and as signs of heart failure. And we talked a little bit about this. To prevent heart damage, what infection do we give penicillin? Do you guys remember?
Isn't it the strep?
Yeah, so
Streptococcal.
strep throat, very, very good. So the antibiotic of choice is penicillin, because if you don't give the penicillin, they can develop rheumatic fever. So rheumatic fever is the complication of strep throat that causes heart problems, but all of these things are serious complications. Pneumonia, rheumatic fever, meningitis, glomerular nephritis, which we'll talk about in a second, and then otitis media. I just want to point out, because to me it seems a little bit tricky because it says serious complications. I don't necessarily think otitis media is that serious, but if you were asked which of the following is a serious complication of strep throat, that all of these listed on here are serious complications of strep throat, including the otitis media.
Well, I mean, their eardrum could burst.
Yeah, that's true. Good point. Yeah, you're right. Yeah. Yeah.
Hmm.
So talked a little bit about blood disorders. So iron deficiency anemia is the most common blood disorder in childhood. And then there are both, we talked about two different inherited forms, the sickle cell and the thalassemia. And you can have either, not enough production of healthy red blood cells or destruction or loss of blood cells. Both of
You said
those.
sickle cell and the other one was what?
Thalassemia. And we'll get to them here. This one here, I would know for sure. I mean, there's 19 slides. I would definitely study this PowerPoint, but this one has information that I know that you need to know. So iron deficiency anemia, common nutritional deficiency in children. We associate it with too much milk. This is the one also, like if they have milk before they turn a year. So like if they're coming off their formula too early, if they don't drink cow's milk too young, and even older in life, milk is associated with iron deficiency anemia. But things like green leafy vegetables have iron, and also there's iron in red meat, but not in fish and poultry. So you should be able to pick out foods that are good sources of iron if a kid has iron deficiency anemia. And then the hereditary blood disorder where blood does not clot, that's your hemophilia.
Isn't that the wolf syndrome, or don't they call it the wolves, or what isn't this? There's something that they call it.
So there's a couple of different hemophilias because it's always based on whatever clotting factor you're missing.
Okay. We just need to know it's hemophilia when there's no clot.
Yeah. You don't need to know the different types of hemophilia.
Okay.
And this is you asked me this, Jessica, the thalassemia. So a hereditary blood disorder where the body cannot produce sufficient adult hemoglobin, that's the thalassemia.
And that's mainly in like the Mediterranean.
That's mainly the Mediterranean.
Right.
Yeah, it is. And there's two types.
Two types.
So if they only have the gene from one parent, it's the minor. And if they inherit it from both parents, then it's the major or Cooley's. But the main thing that you need to know about the thalassemia is they don't produce sufficient adult hemoglobin. So they just don't produce enough hemoglobin.
I'm sorry, you said if it's from both parents, it's called what?
Thalassemia major or Cooley's anemia with a C.
Okay, thank you.
Mm-hmm. And then the other hereditary blood disorder that we talked about is the sickle cell anemia. And that's where their red blood cells are the wrong shape. They're the sickle shape, or like the half moon shape, instead of a nice round shape. And then hyperlipidemia is, the medical term to describe when there's too much fat or lipids in the blood.
Isn't that when their poop floats? I'm sorry, their feces float too, like when they have that?
Yeah, it get like, or the frothy poop, yeah, because
Yeah.
there's more fat, yeah. But like you
Okay.
can, if you go to the doctor for your annual exam, they probably check your cholesterol level. And if it's high, then you probably have hyperlipidemia. So you just have too much fatty substances in your blood. But if you're not digesting fat well, not able to break it down, then yeah, your poop will float because it's not being digested normally and it has a different volume mass. So I will honestly say the GI/GU stuff is not heavily tested on the exam. So, for sure focus, if you had to prioritize your time, I would make sure you know the cardiac stuff and the respiratory stuff. There are a couple GI/GU, but it's not as heavily focused as the cardiac and the respiratory. We had a discussion question about pyloric stenosis. You definitely should be able to recognize that's the one that's associated with the projectile vomiting. We'll see appendicitis in children. It's pretty similar in children as in adults. So if you've studied appendicitis in med-surg, it's very similar in pediatrics. But there's a term that we use, I don't see it on here, but do you guys remember McBurney's point?
I remember you saying something about it.
Okay, so I would remember McBurney's point. That's the place on the abdomen where they have pain that's associated with appendicitis. So that's going to be your right lower quadrant.
Oh, it's that spring back. If you push it and it comes back, they're going to scream in pain.
Yeah, and that's the rebound tenderness, but the actual physical point where you touch them is called McBurney's point.
And you said right lower quadrant, right?
Mm-hmm, mm-hmm. And if it's ruptured, if the appendix ruptured, that's a more serious condition than if they come in with it inflamed, but it hasn't ruptured yet. And it does require surgery. And then there's a congenital disorder called Hirschsprung's. And there's inadequate motility of the intestine, so there's not a normal impulse to the intestine. This one is associated with Down syndrome. And there's a range. Sometimes they just need some little help going poop, and sometimes they have to have a colostomy where they pull the intestine out to the skin and then they poop out their ostomy on their stomach. So mainly you need to be able to recognize that they don't have normal peristalsis because they don't have normal nerve impulses, and it's associated with Down syndrome. This is one of the ones that if they don't have that meconium stool in the first 48 hours, then you might think they have Hirschsprung's.
Okay.
So celiac disease is an autoimmune disease where they can't digest gluten, or they have like an allergic reaction to gluten. So this is the treatment for celiac disease is avoidance of gluten. So this is a lot of dietary management. So you do need to recognize that the most common ingested drug that causes toxicity is acetaminophen or Tylenol. So people sometimes think because stuff is over the counter that it's not that dangerous. So you can get really sick with Tylenol ingestion. You can go into liver failure. So this is the most common thing that, you'll see it if you're working in a pediatric hospital, suicide attempts or kids get into stuff. The most common ingested drug for toxicity is acetaminophen. And then acute glomerular nephritis, we talked about this also with strep throat. So this is where you have like an allergic reaction to the strep bacteria, and it ends up attacking your kidneys.
And then what that is it's just not filtering. The filter part of your kidney is not filtering correctly. And so protein is getting in them holes, right?
So yeah, so we also talked about protein in terms of nephrotic syndrome, but yeah, this is also true with glomerular nephritis. They'll lose protein in their urine. They'll end up with edema. They'll be pale. They can also end up with anemia. Someone sent me a chat here. Hold on. Someone asked about theories. I just looked at the test. I don't remember any theory questions on this test. So the main thing that you have to remember about glomerular nephritis is it's related to an allergic reaction that then causes this autoimmune reaction in the kidneys and its reaction to the strep throat. So it's not uncommon for kids to complain of constipation. So with kids, we almost always start with diet. So you're going to do raw vegetables and fruits, increasing water before you would ever give any sort of a medication. We talked about dys being difficult or bad. So dysphagia is difficulty swallowing. And this has the McBurney's point on here in case you didn't understand me or you needed it written down. So the guarding rebound head and nose pain at McBurney's point, that's your appendicitis cue. I think you guys probably know this, that in terms of the urinary tract infections, that girls are more at risk than boys because of the shorter urethra. You worry about, bubble baths, hygiene, wiping from front to back, making sure they're wearing cotton underwear, not really taking a lot of bubble baths. They pee after they get out of the bath. We talked about these two things that you might see in boys, hypospadias and epispadias. And the cryptocriticism is the failure of one or both testes to descend. So these are, things that are specific to boys.
A different one. Oh.
There's a couple skin questions. So definitely remember that impetigo is that someone mentioned in one of my classes that kind of runs through daycares. It's highly contagious. It's usually staph or strep that causes these lesions that cause like honey crusty stuff on the face. Usually it's common around the mouth. So they need to be treated with antibiotics. And it's highly contagious, but it's a skin infection caused by staph or strep that causes these bullous lesions. So they're kind of like raised pustules and they have like a honey yellow crustiness on it. Ringworm is going to be fungal. Pediculosis, again, kind of remembering the medical and the layman's term, is lice. Eczema is associated with allergies. You can see it in infants, and it's treated with creams usually. Scabies, we didn't talk about it a lot, but this is also highly contagious. They lay their eggs under the skin. So this is the one where you see them you'll see like track lines in between their nails, or I'm sorry, in between their fingers. So you'll see like little lines. This is also highly contagious. You have to treat the whole family. And then just remember that burns are a serious problem in pediatrics. It's the leading cause of death in children 1 to 4. And your primary concern, obviously there's lots of concerns, but you worry about airway, especially if there's any burns to the face.
I have a question, I'm sorry, about the
Yeah.
rule of 9.
Yeah.
Will we need to know the percentages, or will it be on the?
Yeah, you don't need to know.
Okay. Okay, thank you.
You're welcome.
Because I was just gonna ask the same thing, because it's different for the adult. than
Yeah,
it
there's
is for
the
child.
chart in the handout too, because they have different body proportions.
Yeah.
So yeah, you don't need to know.
Okay, thank you for that clarification.
Yeah. So we talked about a couple different metabolic problems. The two most common, so the most common is diabetes mellitus, but diabetes and hypothyroidism are the two most common in pediatrics. So you for type 1 diabetes, which is much more common in kids than type 2, you worry about not enough insulin production. And your triad is the polyphagia, polyuria, and polydipsia. So polyphagia is you want to eat a lot, polyuria is you're peeing a lot, polydipsia is you're really thirsty. Sometimes they are quite sick when they present. They can go into diabetic ketoacidosis as one of their presenting symptoms. And sometimes they're diagnosed earlier, and if they're peeing a lot or they're wetting their bed and they had previously not, that could be a sign that they actually have diabetes. This is one of the ones that able to identify signs of hypoglycemia. So this would be like they got too much insulin. We also call it insulin shock. All of these on here are signs. So being really hungry, weak, irritable, kind of confused, pale, sweating. So you can have a seizure because your blood sugar level is so low, but we don't consider that a sign of hypoglycemia. That would be like an extreme situation, it went way beyond the blood sugar getting low and it had that negative outcome. So I would not, I know that people kind of generally know as general knowledge that sometimes a really low blood sugar can lead to a seizure. But if you were looking at the signs of hypoglycemia, I would remember the ones that are on this slide and not associate having a seizure as being a sign. So if you ever have someone that you think has hypoglycemia, your best action as a nurse is to give them something that has sugar, some juice, a graham cracker, etc. Let me take a look here, make sure I got all of your chat questions because we're almost done. Okay. So we also talked about diabetes insipidus, which even though it says diabetes, is not at all related to insulin. So this is the very, very brisk urine output. So this one, diabetes mellitus, we say polydipsia, polyphagia, polyuria. Diabetes insipidus, there's just two polys, polyuria, polydipsia.
Our med surg teacher said when you think of diabetes insipidus, you think of copious amounts of pale urine.
Yeah, it's just like the faucets are on full force and they're just dumping urine. And you do need to really monitor their vital signs closely. They can become hypotensive because they're losing so much fluid through their urine. I don't think we had the time to talk about this because there were 4 chapters of the last week. So you do need to remember that vaccines give you acquired immunity. So acquired immunity would either be from vaccines or from having the illness. So you need to remember that vaccines give you acquired immunity versus something like passive immunity is like breast milk, etc. Acquired immunity lasts longer. So the DASH diet is something that, if we had a child that had hypertension, we would start with diet and exercise modification, and a DASH diet is a good diet for lowering blood pressure. And it's low fat milk products, fruits and vegetables, fish and poultry, and low sodium. These are the 4 components of the DASH diet. And this is just kind of randomly on here. Erythropoietin regulates red blood cell production. So this is a hormone that we naturally produce that regulates our red blood cell production. Sometimes we give it to patients that have decreased red blood cell production. So you can give somebody subcutaneous erythropoietin and it helps their bone marrow stimulate red blood cells. The last thing on here is Cushing syndrome. It's not a very common metabolic condition. It's associated with overproduction of cortisol. So they tend to have like a moon face, which also you'll see in kids that have chronic steroid use. Thin extremities and ruddy cheeks. I wouldn't spend too much time on Cushing syndrome because it's a very rare metabolic condition in children. We don't really see it very often. And then this is just kind of reminding you to pay attention to weight dosage calculations. There are 5 on this test, like all the other tests.
Are they going to give us any questions in regard to like the safe zone? You know how they always ask, what is the safe zone for the child? And you need to be able to break it that they give you the order, and then they'll ask you, is this within the safe zone for the child? And then they want you to
like they say like the maximum dose is 50
the
milligrams per kilogram.
Yeah.
Like the safe dose.
Honestly, I don't think so, because all of them are like fill in the blank where you have to put a number down.
Okay. All
right. Do you guys have any other questions?
Not really.
Okay. So gives me a little while to post it, but I'll make a YouTube link of this and I'll post it in the announcements. I have Dr. Bobart's. I have to look and see if I have the other Dr. Rebecca's. I don't know how to say her last name, but I'll look for hers. But I'll put all of the review recordings on the same announcement.
All right. Thank you.
You're welcome. I'll see you guys next week.
Bye.
Thank you. I appreciate it. I have a question.
Oh,
Can
yeah,
I,
sure. Yeah,
no,
go ahead.
Can I talk to you for a minute once everybody else hangs up?
Yeah, let
I'll
me
hang up.
stop
I'll hang
recording
up.
this really quick. And then you're free to, let's take a look here.